Good morning, Maura.
Hi.
Hi. Please tell me, what is your number one concern? If there's only one problem I can solve for you, what would that be?
Fatigue.
Okay. Describe, how do you mean by fatigue?
Basically running out of gas every 3 or 4 days, crashing and burning is what I call it. After about noon or 2 in the afternoon, I'm sapped, just very low energy. Compared to a couple years ago, I was always high energy, always on the go.
You always were until a couple of years ago?
Yeah.
Okay. All right. And your number two problem?
Headaches.
Okay. And point to me where that is.
In this area right
Okay.
here.
All right. And number three?
Just achiness, muscle aches.
Where would the achiness be?
Upper body, here. When I crash and burn, it's almost like flu-like symptoms, just achy, tired.
Okay. Do you have any achiness in the back of your neck, back, anything like that at all?
I do get a stiff neck every once in a while.
Okay, can turn around and point to me where that is.
Right here.
Uh-huh.
Never really related it to all this, but that's part of my achiness.
Okay, so when you say achiness, that includes that?
Yeah.
All right. Is there a number four?
No. I can't think of a number 4 right now.
Okay, so if you can solve that, we're doing good.
Yes, absolutely.
All right. Thank you. All right. Hi, what's your name?
Maura Vogt.
Maura, would you tell me your story?
I am 45 years old, married with 3 kids, and I started seeing Dr. Rahman.
I'm here. You can have me.
I started seeing you in December.
December of 2010.
December of 2010. After being told about you for almost a year and a half prior to that. From a colleague at our company, All-Star.
You and Bill own a company.
Correct. All-Star Awards, and Doug Ford, our general sales manager, has been a long-time patient of yours, and he was telling me I should go see you, and I kept putting it off, and I was trying other remedies or other avenues.
What were some of the symptoms and problems that you're dealing with, so Doug was asking or recommending that you should come see us in the first place?
Right. About end of 2008, November 2008, I started dealing with some pretty chronic migraine headaches and fatigue. And come to find out, the fatigue kind of predates that, even another 4 or 5 years.
Back in 2000?
2003, 2004, because now that I'm feeling better, I didn't realize I wasn't feeling good those few years with the fatigue.
And you're dismissing it as?
I was just thinking, because I was working full-time and busy mom and getting involved with the kids' activities.
You have 3 children, you said.
3 children.
Busy.
And, but the headache started, and it was...
you can point to me.
Yeah, it was on the, I believe it's the left side of my scalp, right here, a tingling, kind of a dull sensation that wasn't very painful, but it was a kind of unnerving, because it made me think something was going on up here. And soon after that, a migraine that would go from all the way around the front to the other side of the head came. If this started in November, it was about December, January.
Which year?
2008, I'm sorry.
Okay.
2008.
This is June 2011, right now.
Correct,
okay.
Yeah. And this started in November of 2008, and by December, January, it was a full-blown migraine across the top, and it was chronic. It was 24/7.
Okay.
Never more than a scale of maybe 6 on a 10 pain scale.
Okay.
But there, and
would you ever have any relief?
not until about 8 or 10 months later, after finally finding the right neurologist who was seeing me. She broke the cycle of the headaches with a drug called Lyrica, which I never want to be on again.
Because?
Because of the side effects, the weight gain, and it gave me another foggy feeling that I didn't enjoy having. But it broke the cycle of the headaches, and then she put me on to a natural supplement called butterbur root, which was part of a drug called periodontist, and I discovered it was just something I could get at Whole Foods. And ever since then, the chronic part hasn't been an issue, but I would still get them, and then I was able to knock them out with Excedrin migraine, where I wasn't able to knock them out with anything until that 9 or 10 months passed. So toward the end of 2009 is when I broke the cycle of the headaches.
Okay.
But at the same time, I was dealing with a lot of fatigue, what I called crash and burn moments. I really wanted to keep working and doing things, and by the 5th or 6th day, I would just crash and burn and be out for 2 or 3 days.
I see.
And all the while, I'm also seeing a hormone treatment doctor. I have thyroid disease from when I was a kid. I don't have a thyroid gland. So they were tweaking my thyroid. They were looking at my adrenal glands and my hormone. I started getting hormone injections. All the while, still not feeling 100%, still having the crash and burn moments, still getting the headaches, but being able to knock them out with Excedrin migraine and kind of resigned to that's just how it's going to be.
Okay.
Another thing that was going on through all this is my teeth. In '07, was referred to a periodontist for a...
Who's your general dentist?
Harry Boydston.
Okay, and he sent you to
And he sent me
Dr.
to
Wendt.
Dr. Stanley Wendt,
Mm-hmm.
who has done some work for my husband in the past. So I went to him for a gum graft.
Yeah, they said that the gums were pulling away.
They'd been
The
receiving...
bone was being lost.
Correct. Due to bone loss, I needed a gum graft or a skin
Okay.
graft. I did
Was
that.
anything discussed about why you had bone loss and
No.
gum recession? Okay.
No discussion as to why.
They fixed the problem and not so much what caused it.
Right. The best remedy at the time was use a softer bristle brush and just take care of the symptom of them going away.
So the softer bristle toothbrush is implying you're brushing too hard?
Right. That was one of the theories, is that I was using that not the Oral-B version, the Sonicare, which was helping with the cavities, but they thought that might be hurting the
Sonicare,
gums.
they thought maybe too
Rough on
too
the
rough?
gums.
It's considered one of the better brushes, that's why I wondered. Okay.
That's what. And
So you're not using anything like a hard bristle brushes by any means?
correct.
Okay, go on, please.
So I had the gum graft done in '07, and when the headaches came in '08 and during the year of '09, I noticed that the gums were still receding, and I was having mobility in the teeth. And we talked to the dentist about it was because I was gritting my teeth at night, not grinding but gritting, and they were moving the teeth. He referred me to an orthodontist,
Wilcoxon? Okay.
who made a mouth guard for me, a night guard.
Okay. And the idea being?
That I would prevent further mobility.
Got it.
Couldn't necessarily stop what had already happened, but could prevent further mobility.
Was it on the top or bottom? Was it a harder?
It was
soft?
a hard plastic on the top.
Got it. Okay.
And we tweaked it several times, but I still couldn't get comfortable with it. It was really hard. And
When you say tweaked it, how was the tweaking done?
oh, he was grinding to make sure it fit my bite, things like that.
And what's the process of finding out how that is biting? Would it put a ribbon in the mouth?
Yeah, he did the ribbon, biting down and just seeing if it visual.
Okay.
Kind of. My kid's dentist, Dr. Corsten in Lee Summit, I was asking him about it. And all the while I'm saying, could this be the cause of my headaches? Is this what's going on? And they said it could be, but you can't get your mobility back. We'll just work on the nighttime issue.
This would have been, who said this?
The dentist and the perio, Dr.
Boydston
and Dr. Wendt.
Got it. And you mentioned about Dr. Gerald Corsten.
Dr. Corsten, my kid's dentist, I started telling him about it, and he sent me to Dr. Barr, B-A-H-R, in Blue Springs, and he said he will get you squared away on the right kind of night guard. So I went to him, and he made a quick and dirty, real easy, rubbery piece that really was more comfortable for me.
Okay.
And that's what I was using when I came to see you.
Okay.
So,
It was comfortable to wear at nighttime compared to the hard one.
correct.
Okay. How about the other symptoms you were having? Fatigue,
It
headache,
did not help any of the
ear
other-
pain also you had?
There was some ear stuffiness and ear pain that I attributed to. I was also, through this whole time, I was seeing an allergist for non-allergy symptoms, sinus issues, but I would get a sinus infection maybe twice a year after I hit age 35. I haven't had one since I started seeing you, and I haven't had any of the non-allergy symptoms that they were talking about either.
Interesting,
So,
huh?
Yes. So, anyway, so in
You mentioned neck pain. Also, I'm looking at this here. You had neck pain as well? That's one
well,
of the...
I would have a stiff neck about every 3 months, and I just assumed I slept on it wrong.
Okay.
And
You mentioned about shoulders too a little while ago, I think.
right, and my shoulders, I didn't realize were tight, and until about a week after the orthotic was in and I was driving, and all of a sudden everything's falling down into place and very, very relaxed and comfortable, and realized that that was
You didn't know any different before?
I
You
didn't
just
know
felt-
that was a symptom. I was so focused on the headaches and I have a friend who's a chiropractor. When I would have a stiff neck, they'd work on me and they'd talk about how tight I was, but I never knew that it was related.
How not to
this.
be
Right.
tight. Okay.
Exactly.
All right.
Exactly.
And so we met in December of 2010.
Correct.
And I think, what did we do at the time for you?
That's when we did the initial evaluation, and where you did all those tests to even see if I qualify, if I am a candidate.
Mm-hmm.
And I certainly was. And then January 4th is when you put in, January 4th of 11 is when you put in the orthotic.
Okay, that is a fixed orthotic on your lower teeth.
Correct.
Do you remember what our game plan was for 90 days?
Just to see if that by tweaking the bite that much, that I would see a decrease in the symptoms.
Okay. Was there a substantial change between how you used to be and?
No, and the bite itself, it was amazing. It was very small. It wasn't a painful thing to move.
Okay.
But
So it felt okay pretty soon?
absolutely.
Okay.
And this,
All right, we were speaking with Maura, and I think the last I stopped, it was you were in braces for how many months now? Since
3 or 4 months
4
now,
months, okay.
since March.
And I think we also talked about you had orthotic for 90 days, and it was your choice to either not to continue on if it didn't help you,
Right.
or if it did help, you had several options to choose from. The one you chose was orthodontics.
Correct.
Okay. So tell me about the progress since that time. The last month, your symptoms were?
They're gone. My symptoms are gone, and they remain gone.
And this month, that's all 100% gone?
Same.
99.99?
99.99. I
Okay.
have not had a lot of discomfort with the braces or pain, and I can almost feel them moving around up top to match the bottom better.
Okay. Well, in what ways has it impacted your life beyond fatigue, and what does it allow you to do now that you didn't before? You're doing a lot of
I'm
things.
just able to be a better mom. I'm able to get up in the morning without feeling tired by 10 or 11. I'm not having to take naps. I'm able to exercise for more consistent periods of time.
Yeah, because you kind of mentioned one of the side effects of one of the medications was some weight gain.
Weight gain, which I still have to lose some weight, but I'm doing one thing
You're
at a
able to do it
time.
now because
I
you have
am.
energy to do it.
Correct, and just more consistent. I'm not waiting for that 5th or 6th day where I might crash and burn. I'm just not having that anymore.
I see. Crash and burn is where you described you go for several days and
And then I
Then
just
we-
have to sleep. I feel
for-
like I have to catch up for two or 3 days.
I see. And that'll happen about after how many days of running?
4 or 5,
I see.
actually. My
That's-
longest stint in that last 3-year period was 6 days, and then I would crash.
Okay.
And
But now you have, since the orthotic was in January of this year, early January 2011, now it is June 15th.
Correct.
Have you had any crash and burns in that length
No,
of
I
time?
maybe had one in January, but that
Soon
was
after?
it. Yeah, soon
Okay.
after the orthotic, but since then, none.
Okay.
So, and when I wake up, I'm rested. I'm sleeping better. So,
Because one of the things that you earlier mentioned was, one of your colleagues mentioned about our practice for almost a year and a half.
yeah.
And it was just hard for you to believe, wasn't it?
Right. Well,
Okay.
and because I was already seeing multiple dentists and orthodontists who were supposedly addressing the issue, and so I was going to keep trying that until I figured,
Why one more dentist, right?
Right,
It
right.
makes sense.
Right.
Okay. What have you discovered since? Any difference?
Oh, I
What-
highly recommend. I think more dentists need to think outside the box a little bit more, and I want to be the new poster child for
I think you did say that, didn't
for
you, when
this
you first came in?
process. And just, I was already seeing an alternative medicine doctor who was helping me with the hormones and the thyroid, and yet there was still something going on. And it's okay to think outside the box in a dental
So if you were
capacity.
to, if somebody were to see this and they had some of your symptoms, what would be your advice for the person?
My first step would just be to get evaluated. because I had gone to several neurologists and not a single one of them mentioned TMJ or anything along the line of dental care, even when I was telling them about my night guard and my gritting of my teeth.
I think I only know about Dr. Bickle, Jennifer Bickle. Who else did you see?
Well, they admitted me to the hospital in November of '08 after I had gone to the emergency room with the headache.
Oh, I didn't know that. Go
Yeah,
ahead.
I went to the emergency room with the headache.
Which hospital was that?
The urgent care wouldn't take me, Shawnee Mission Medical Center.
Okay.
And then they couldn't find anything. They told me to see my regular practice doctor, Sandra Archer. She ordered an MRI, and evidently the individual reading it was, they have to say everything it could be. So they admitted me to the hospital, and when all was said and done, they really didn't need to, but they were trying to be careful because it could be mini strokes, it could be this. There were some specks on my MRI, but in the hospital over Thanksgiving weekend when nobody was really around,
Oh, ruined your
I had a
Thanksgiving.
neurologist come in and say, this is a normal MRI, there's nothing wrong with you, it's in your head.
It's in your head.
It's in my head. And so that's when...
Meaning what?
That this is psychosomatic and you're not having a chronic headache issue, basically.
I see. Yes, I was just wondering about what he meant by that. Okay.
Well, that was my bad
How does it make you feel
experience.
when a specialist says you're having all this pain but says you're psychosomatic?
I was very upset. And my sister was there who's in the medical profession, and she helped me find a neurologist. And
What does she do? What's your sister?
She's a physical therapist,
Okay.
but works in the neurology division of St. Louis University, and so works with a lot of neurological patients, and so she helped me find a neurologist that would sit down and listen to me. And that's where I found Jennifer Bickle over at KU Med Center. And she ordered similar tests, and even the spinal tap,
Spinal tap,
that they even did that and couldn't find anything. And she's the one who prescribed the Lyrica,
Okay.
which did break the cycle, but was a drug I wouldn't recommend to anybody.
Okay.
So,
All right. Anything else you want to add?
no, I'm a firm believer, and I think my husband is too now. So,
Thank you so much, Maura.
thank you.